Hello, my name's Adrian. Thank you for watching this video. I'm the plastic surgeon and the surgical director of Aurora clinics, and today I'm going to be talking about a new type of facelift called a MACS facelift. I'm discussing what it is and who's suitable. Okay, so a traditional facelift, which I'm going to talk about in other videos, is known as got a lot of names, but might be known as a smash facelift, a deep plane facelift. All these are words which I'll discuss in other videos because the words used to describe facelifts are really complicated. So I'll slowly work through that in the videos. Okay, so what is a MACS facelift? Well, basically a MACS facelift was first devised as a modification of the S-lift, which was very popular in Europe probably about 15 years ago. The MACS facelift was really devised and modified in Belgium in 2001. Okay, now who's it suitable for? Well, basically it's suitable for the younger patient, normally 45 to 55. Okay, why is it different from a normal facelift? The real difference is that a traditional facelift goes behind the ear, so it also lifts the neck. The MACS facelift tends to lift the soft tissue of the cheek more vertically, so upwards. Yeah? So whereas a traditional facelift is more back, it's very good for tightening the neck, a MACS facelift lifts more upwards. Yeah? So what it does is it lifts the cheek, nasolabial fold and jowls. A MACS lift does that. I don't know if you can see that on the video, but it does that. It does not do backwards, it does up. Yeah? So where your cheeks, I'm probably a good example of this, your cheek, the prominence of your cheek used to be up there, the gravity has gone down, the jawline with time goes down, and you tend to get sort of jowling here. So what a MACS lift does, line incision in the hairline here, in front of the top part of the ear, normally behind the knobble of the ear, the tragus, and down, is do this. Okay? Yeah? So, who's suitable? Relatively younger patients, really 45 to 55. People who are generally very fit and healthy, people who don't want a lot of downtime because very quick recovery, and it doesn't work that well for people with really loose skin in the neck, particularly in the middle. So if you've got really loose skin in the neck, a MACS isn't for you. You really need a specialised neck lift, which is a different procedure which I'm going to talk about. So in summary, MACS facelift has MACS. The initials stand for minimal access, which means short scar, unlike a normal facelift. Cranial suspension. And cranial suspension basically means that these soft tissues which I talked about, which we're going to lift up, are firmly anchored to the deep tissues of the scalp here. So MA, minimal access, CS, cranial suspension. Okay, the MACS facelift. So good for younger patients who want a quick recovery, who haven't got a really saggy neck, who want basically rejuvenation, putting the skin and the soft tissues back where they were 10 years ago. So very good technique in selected patients. And if you'd like to know whether you're suitable, think you might be suitable, please send us a photograph of yourself, or better still, arrange a consultation to come in and so we can discuss the best way forward for you. If you'd like to arrange a consultation, I'll do so via email to the Aurora website, or phone us on 01844 214 362. Thank you for watching.